joining us for this informational video about the Healthy Start Coalition of Osceola County.
So Kayla, tell us about the Healthy Start Coalition of Osceola County.
The Healthy Start Coalition of Osceola County's mission is to promote the health and well-being of mothers, babies, and families in our community through diverse resources at no cost to the consumer. The Healthy Start Coalition of Osceola County was signed into law in June 1991 by Florida Governor Lawton Chiles. When it first began, the United States had one of the highest mortality rates in the modern world. In its short time as an organization, it has been credited with helping reduce infant mortality in Florida by 23%.
So how would somebody join or leave the group?
Consumers of care are evaluated by healthcare providers through the use of Healthy Start prenatal and postnatal screening instruments. These screening questionnaires evaluate pregnant women and infants according to medical and socioeconomic factors to determine if they are at risk for poor pregnancy outcome. While it is Florida law that all pregnant women and infants be offered the opportunity to be screened by their healthcare provider, it is strictly voluntary on the part of the consumer. If they choose to be screened and screen a score of 4 or more, or are referred by their doctor for other reasons, they are invited to participate in the Healthy Start program. The program is offered at no cost to the consumer. The Healthy Care Start coordination provider in Osceola County will contact their team of nurses and social workers, and then they will contact the individual to determine the level of need and other related activities. Services include coordination, childbirth education, parenting education, smoking cessation, case management, nutritional counseling, psychosocial counseling, and breastfeeding education and support. These services can improve the health status of women and infants as well as save the cost of high-end medical care.
So tell us about their objective.
Well, they assure that the many barriers associated with maternal and child health are minimized, including economic barriers such as money issues associated with being young and having kids, or even older moms struggling financially. Social barriers such as the social stigmas of having children young or out of wedlock, and they are always there to provide emotional support. Geographic barriers such as being in a bad area or living in an area that doesn't provide the necessary services. They want to make the process as easy and carefree as possible while providing an adequate number of healthcare providers to assist women throughout their pregnancy and continue with the assistance for their children afterwards. They basically help at-risk pregnant moms get the resources they need and can't get on their own, such as helping sign up for Medicare, make sure they choose a prenatal doctor and are actually attending their appointments regularly. And they provide education on parenting, breastfeeding, safe sleep, and all the things associated with new infants that mothers may struggle with. If a mom doesn't have access to a crib, they'll help them get one. They provide these services throughout their pregnancy and up to 8 weeks postpartum. They give them enough time to help establish themselves as mothers and to teach them the skills necessary to care for their infants on their own. They estimate that they help around 3,000 women and children each year.
How did they get to help so many people?
attend monthly community meetings and events to discuss what they're doing and keep everyone updated. They send out emails providing information on their programs and the services they provide. They also have advertisements at Links bus stops with the campaign titled "Get Healthy Before You Get Pregnant."
But what about their interpersonal relationships?
As the Healthy Start Coalition of Osceola County, they strive to create warm environment to conform all their employees as well as the consumer of care. The administrative team consists of 4 members, including executive director, bookkeeper, program specialist, and mom advisors. They refer to their small team as the back of the office to the Healthy Start. At this organization, decisions are made in a vertical manner, meaning all the decisions are made in executive level. However, the opinions of all employees are considered invaluable. The organization looks for individuals who are honest, reliable, hardworking, and most important, must possess excellent communication skills in their employees and volunteers. It is a priority for any applicants or current employee to always keep in mind the comfort and the well-being of all our care consumers. Pregnant women tend to be extra sensitive and emotional. Therefore, discretion and tact should always be essential for the communication between the organization and all future and present care consumers. Also, the relationship with their volunteer is crucial for the growth of the organization, as well as the continued interconnectedness between the Healthy Start Coalition of Osceola and community. Overall, this organization seems to be fun and friendly and caring environment for all.
So how did you research this type of group?
In order to research this type of group, we opted to use online sources, as well as conduct an interview with the Healthy Start Coalition Program Specialist, Ms. Carrie Ann Linville. Many of the information pertaining to the Coalition's resources, objectives, and mission was located on their website. However, it was the actual interview which provided us with the first-hand look to their day-to-day activities. We also used scholarly articles with information regarding expectant mothers and premature babies, which seems to be the Healthy Start Coalition of Osceola County's main target group. If you're interested in learning more about the Healthy Start organization and about what they contribute to the community, or are interested in volunteering or working in the nonprofit sector, you will find the following information useful. Again, thank you for joining us in this informational session about the Healthy Start Coalition of Osceola County. We hope you find this information useful, and we'll see you next time.